Welcome to our practice. We are woman-to-woman gynecology and all-women care. We're a women's health clinic providing regular gynecologic services and a discreet abortion clinic offering boutique family planning services. Our doctor is a woman. She is a Las Vegas gynecologist with over 20 years of clinical experience. She has been the recipient of multiple patient care awards. You will be in good hands. When you arrive for your appointment, you will complete paperwork about your health and provide us with general demographic information. We will ask you for your insurance card, if you have any, in the event outside laboratory work is needed. Being thorough and truthful is very important as your safety is at stake. You will meet our medical assistant who will review your paperwork, answer your questions, and take your blood pressure, temperature, weight, and height. We will request your pharmacy and emergency contact information for your electronic medical record. We will then perform a pelvic ultrasound. During this evaluation, we check the uterus, the ovaries, the cervix, and the location of the embryo. We also confirm how far along you are. In addition, we exclude the presence of an ectopic pregnancy, which is located in places such as the cervix, the fallopian tube, or the abdomen. An ectopic pregnancy can be very dangerous and may require medical or hospital surgical treatment, which is different and more involved than a routine pregnancy termination at the office. We will draw your blood to find out your blood type. This is important because should your blood type be Rh negative, you will need a vaccination with a medication called RhoGAM to prevent serious complications in future pregnancies. We will review the Mifeprex information. Mifeprex is also known as RU486, the abortion pill or early option pill. It is a medication that blocks the hormone called progesterone needed for early pregnancy development. When this hormone is blocked, the pregnancy no longer develops and as a result miscarries. The miscarriage is made complete and more effective by combining the Mifeprex with the medication called misoprostol that causes strong uterine contractions that aid the evacuation of the uterus. Multiple studies in the medical literature have confirmed its safety and tolerability. The risk of complications is minimal. Less than 0.3% of all abortion patients have serious complication that requires a hospital treatment. Abortions done during the first 3 months of pregnancy have almost no long-term risks to fertility, ectopic pregnancy, miscarriage, birth defects, premature delivery, or low birth weight. In the United States, abortion is legal. The United States Supreme Court has ruled in 1973 that a woman has a constitutionally protected right to choose abortion in the early stages of pregnancy before fetal viability. When combined with misoprostol, the effectiveness of abortion with the Mifeprex abortion pill is 92 to 98%. It can fail when not taken properly and when the instructions are not followed. When it fails, the pregnancy continues to grow or may not miscarry. In both of these cases, a surgical evacuation is necessary. Surgery may also be necessary in the case of heavy bleeding and infection, both of which are rare events. Pregnancy termination by abortion pill is now becoming a very common method because women prefer it over surgery. The early option Mifeprex abortion pill affords women privacy and simplicity. It feels more natural, just like having a heavy period. Surgery, anesthesia, and emotional discomfort, as a result, are avoided. In our office, you will take 1 tablet of Mifeprex, the abortion early option pill by mouth. You will also receive an antibiotic to prevent infection. We will then dispense 4 tablets of misoprostol for you to use vaginally within 48 hours at the privacy of your own home. The misoprostol tablets are placed high in the vagina 48 hours after taking Mifeprex, the abortion pill. It is best to place them just before going to bed so they do not fall out. Before placing them, wash and pat dry the outside of your private area and your hands. Take the misoprostol tablets in your hand and one by one push all 4 tablets inside the vagina as high as possible. Then place a super absorbent pad in your panties. Wash your hands again. Take a pain tablet by mouth before the pain starts, at the same time as placing the pills vaginally. Then go to bed or lie down for at least 4 to 6 hours. This will prevent the pills from falling out of the vagina and help them get absorbed into the bloodstream. Use a heating pad as needed for pain. Within the next 6 hours, cramping, pain, and bleeding will start just as if you were having your period. The miscarriage has begun. The bleeding would last about a week, just like a heavy period. You may, though, have bleeding for 2 to 3 weeks, but it is usually light and brown in color and not associated with cramping. On and off bleeding is common up until the follow-up appointment. Please call us immediately if the bleeding is heavy, consisting of more than 2 pads per hour, and not getting better with the additional misoprostol tablets we have prescribed. Severe cramping associated with heavy bleeding that doesn't improve with the medication also needs to be reported. Rarely, a surgical procedure to remove clots may be necessary. We will see you for your follow-up in 3 weeks. We will check a pregnancy test to make sure that the medical abortion is complete. Often, the pregnancy test is still positive, at which point we perform a repeat ultrasound to make sure that the pregnancy is no longer present. Rarely, if the pregnancy persists, we perform a surgical evacuation. We will discuss the different methods of birth control that may be suitable to you. You may have birth control pills, the patch, the NuvaRing, the Depo-Provera shot, the Nexplanon, the intrauterine devices, or otherwise called IUDs, condoms, or diaphragm. The placement of the Nexplanon or IUDs will be done at a separate visit, and they have different costs. If you have insurance that covers them, we will authorize the contraceptive devices for you, obtain them, and call you back for placement. During your follow-up visit, you may also have your annual physical exam along with your pap smear and screening for sexually transmitted infections. Your follow-up visit finds you in good health. Success! The pregnancy termination has been effective and complete. There is nothing to worry about. Life will go back to normal again. Dating and being sexually active can resume for as long as you have effective contraception and STD prevention. You can now opt to return to our office in a year for your Well Woman visit. Well done.